That says recording.
Okay, thank you. Welcome everybody to the meeting of the East Lothian Integration Joint Board on the 14th of December 2023. The meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available for up to 6 months. And I'll pass on to you, Clerk, Miss Curry.
Thank you, Chair. We have apologies from Councillor Jordan and from David Aston, and I'll now do the roll call of attendees. So if you could just confirm when you hear your name, please. Councillor Akhtar.
Present.
Councillor Finlay.
Present.
Councillor McFarlane.
Present.
Andrew Cogan.
Present.
Elizabeth Gordon.
Present.
Fiona Ireland.
Present.
Peter Murray.
Present.
Do we have Maureen Allen? David Binney.
Present.
Lindsay Byrne. Philip Conaglan.
Present.
Sarah Gosner.
Present.
John Hardman.
Present.
David Hood.
Present.
David King.
Present.
Claire MacDonald. Claire McIntosh.
Present.
And Marilyn McNeil. Oh, Marilyn. Thomas Miller.
Present.
And Fiona Wilson.
Present.
Thank you. That's the roll call of attendees. Do any members have any declarations of interest? Oh, that's great. We're ready to start the business, Chair.
Okay, thank you. Just before we start, I want to welcome Sarah Gosner to the meeting today. I don't know, Sarah, if you want to say a few words or just introduce yourself.
Thank you very much. Hello, everyone. I'm Sarah Gosner. I am the new Chief Nurse for East Lothian and Head of Quality. So it's lovely to meet everybody, and hopefully I'll meet people face to face as the weeks go on. This is the week 3 for me now.
Okay, thank you very much. Welcome to East Lothian Health and Social Care Partnership, and we look forward to meeting you and working with you in the months and years ahead. Okay, thank you. Move on to agenda item number 2, which is minutes of minutes of the last meeting. And if we could all approve them for accuracy. If I have any points of accuracy on page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, 9. Are we happy to approve them as an accurate record of our last meeting?
Approved.
Thank you. Move on to 2, which is matters arising. If you have any matters arising on page 1, page 2, page 3. On page 3, there is a reference made to a workshop. We now have a date in the diary for all IJB members of the 25th of January for our finance workshop. Page 4. Page 5. Page 6. Page 7. Page 8. And page 9. Yes, we don't have any matters arising. Okay, thank you. I'll move on to item 3, which is the chair's report. Just before coming on to the meeting, and I think we'll probably have a look at how get more detail on it, that there's been a delay in the National Care Service by 3 years. I've just seen some newspaper headlines, so I think we'll need to get a bit more detail of that, and we'll circulate that around to all IJB members, because I know that's something that we've discussed ourselves and as partners on numerous occasions. I think one of the reasons behind the delay was enabling it to make some savings as a Scottish Government, because I think the costs for the National Care Service were really spiralling and were quite considerable, and there's a mention of a considerable saving to be made by delaying it by 3 years. So we'll get more information and circulate that as and when we have it. Some other things I wanted to mention that have been happening over the past few months since the last IJB. I attended a conference at Queen Margaret University focusing on intergenerational work, but looking at the cognitive development for older people as well as children and young people. And we had 2 academics that came along to look at the brain development for children as well as older people, and just the benefits of intergenerational work and the positive outcomes that intergenerational work brings specifically for older people. So I'm quite keen to make sure that how we can share that. There will be a recording available of the event and also slides, and if anybody's interested, get in touch. I'm happy to circulate those if anybody that's interested in how we improve the outcomes of older people through intergenerational work. There's been a number of AGMs that have happened over the last few months as well. Claire Mackenzie had her first AGM at East Lothian at ELHSCP, and it was well attended, and it's really quite powerful, the number of hours they've provided to people with learning disabilities and mental health. It was 400,000 hours over the last year, which made a huge contribution to supporting people to be able to live independently and in their local communities. And the same applied at Carers of East Lothian, that again was well attended. And I know Mr. Binney was there. And a huge amount of work has been carried out by the staff at Carers of East Lothian, but also just recognising and acknowledging the contribution that carers have been making to support people live at home as much as possible, and that was really helpful. One other thing that's happened during this week is you might have seen the Scottish Government came to East Lothian. So we had a visit from the Cabinet Secretary, and it gave us the opportunity to take him to the hospital. I don't know, Miss Wilson, if you want to say any more on that. It gave us an opportunity for him to meet staff, for him to see the good work that's going on at East Lothian Health and Social Care Partnership at Ward 5, but also gave us the opportunity to speak with the Deputy First Minister and the First Minister themselves to be able to outline the good work Health and Social Care Partnership are doing, also to again highlight the demographic growth that's happening, but also that we're making considerable inroads in achieving the programme for government, and the importance of ensuring that there's fair funding as we move forward to gain that. I don't know if there's anything else you wanted to add, Peter, as Vice Chair.
The only bit, just in addition to what you said, there is a I think it's a financial memorandum from Marie Todd that outlines in some detail the position, and the one that's of most relevance, I suspect, to the IJB is the fact that there's a stated continuation of IJBs, albeit maybe in a modified form, for at least 3 years. So all the predictions that were anticipated seem to have come to fruition. So we can look forward to IJBs and maybe seek to influence whatever reshaping there is to become of IJBs is given some attention by this particular board, and helpfully shape whatever changes are made.
Yeah, thank you, Peter. Miss Wilson, did you want to come in?
Yeah, just going back to the visit, just again, and thank you for being with us. It was a really positive visit. They saw endoscopy services where they've just got their joint accreditation, which is an amazing achievement for East Lothian, but also for Lothian. And then just the work of Ward 5. Some of our team were a little pressed on, well, you do it well, who doesn't do it so well? But they answered it brilliantly. And just got the kind of feedback from somebody who was in at the moment getting that service. So I think it was positive, a lot of good stuff going on, and really noted around the work East Lothian are doing and how they kind of compare nationally as well. So yeah, a really good experience, I think, for us, and I hope for him.
Yeah, no, thank you. Yeah, it was. I think it is important that staff get recognition of the good work that they're doing, and also the opportunity for us to really highlight the importance of integrated working and the importance of the whole system working together. And I agree, Peter, hopefully we'll have more input into what this future structures might look like, but not losing sight of that we're there to make sure that we get the best outcomes for our local residents. Okay, thank you. Move on to agenda item number 4, which was membership changes for the IJB and the Audit and Risk Committee.
Do you want me to cover this, Chair?
Yes, is that okay?
Okay. The report is the report recommendations are in 2 parts. The first is for members to note the appointment of Councillor Jeremy Finlay in place of Lachlan Bruce, and he's a voting member for East Lothian Council and will be appointed for 3 years initially and can be reappointed thereafter. The second recommendation relates to the appointment of a replacement member on the Audit and Risk Committee following Councillor Bruce's departure. In the background of the report, it notes that while East Lothian Council had suggested that this should be Councillor Finlay, it is actually a matter for the IJB. So I'll be first of all asking members if they can agree to note the first recommendation in the report, and then we'll move on to the second, the nominations for the Audit and Risk Committee. So do members have any questions before we move to the recommendations? Nope. Okay. So the first recommendation is to note the appointment of Councillor Finlay. So are members happy to note?
Agreed.
Yeah.
Thank you. And the second recommendation is, first of all, inviting nominations for appointment to the Audit and Risk Committee, bearing in mind that it would be a council voting member rather than a Health Board voting member. Peter Murray.
Yeah, I would like to nominate Jeremy Finlay, please.
Thank you. And do you have a seconder for the nomination?
I'll second.
Thank you, Councillor McFarlane. And are there any other nominations? No. Okay. So we'll vote by roll call on the nomination of Councillor Finlay to the Audit and Risk Committee. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Councillor Finlay.
Agree.
Elizabeth Gordon.
Agreed.
Fiona Ireland.
Agree.
Carol McFarlane.
Agree.
And Peter Murray.
Agree.
Thank you. That's Councillor Finlay appointed to the Audit and Risk Committee, and that's the recommendations, Chair.
Thank you.
Councillor Finlay.
Yes, just like to say I look forward to being on both of these committees. I know I've got a lot to learn, so hopefully you'll all put up with any silly questions I come up with, but I look forward to the next 3 years. Thank you.
Okay, no, thank you for taking on that role. And I think if you have any support or training requirements, it'd be useful to know to make sure that you're supported in your role.
Yeah, thank you.
Okay, thank you. We'll move on to agenda item number 5, which is planning older people services. Update on the engagement and process report by the Chief Officer.
Thanks. I'll take this one. It was supposed to be Andrew Main who has written the paper very well, but he is on a training course this week. So I'm just going to present the paper, which is an update to the IJB on the work of the provisioning project and the engagement that's been going on to support that project and the recommendations that will come as a result of that project to the IJB late next year. So the The report asks the IJB to note the contents of the report, acknowledge and agree that sufficient engagement has been undertaken and details gathered to inform the next stage of the Planning for Older People Services project, and note that the similar update report was presented to the SPG on the 23rd of November and was agreed there or noted there as well. So just want to draw your attention to 4.1, which gives you the kind of outline of where we're going, or the timeline of where we're going. So we are on that October to November, so a little late, creating the long list of ideas and suggestions. So we have done significant amount of engagement, some virtually, more probably face-to-face, with community groups and individuals, gathering that information and their thoughts on the challenges that are facing us as we try to deliver services to older people now and into the future. So that long list is the job of Andrew to create from all the suggestions that have come out, and he is certainly challenged by it because there were a lot of suggestions, as you can see from 4.3, where it details the number of people that we have seen and how we have engaged with them, and then further down in 4.5 it lists the sort of areas where we've had those comments that have come back. So altogether we collected and collated 2,220 individual pieces of feedback, and that has translated into 235 suggestions. Now Andrew was keen to point out that was the up-to-date figures when the paper was presented last week, published last week, but he is still going through the final kind of information that we were allowed to incorporate was finished at the end of November, 1st of December. So that is all the suggestions now taken on board, and he is working away on them. So happy to take any questions, but I think it gives a kind of comprehensive overview of the engagement that has gone on and the results of that. Next stage will be to look at that with our community panel and to put it through the hurdle criteria as we've described in other papers.
Okay, thank you, Ms. Kerr. Do we have any questions? Peter?
It's just a comment, Chair. It's just to acknowledge this considerable effort that's gone in to try to elicit views. I think that should be noted, because it's not an easy task. Whilst the numbers, I'm sure, could always be bigger, the access options were there for people should they wish to avail themselves of them, and I think we should acknowledge that.
Okay,
Thanks,
you.
Peter.
And Councillor Findlay?
Yes, thank you. First silly question. Under 4.5, the top of the list with 263 is care at home, but under 4.6, care at home is very near the bottom. I was just wondering if somebody could briefly explain to me why that is.
So it'll depend on what people have said and where they have commented. So we had a number of sort of questions that we posed or challenges that we faced. So I think what Andrew has done is he looks at the theme that it may have, the comment may have reflected on, and then he has some of them. They won't make the long list. Now that might be because they are simply a process issue that we would take forward, or it's just a comment that somebody has made, so they wouldn't then go down onto his long list. So it's just somebody has said something about care at home. It may be that it doesn't make it onto the long list because it was just a comment, or it was a thought, or it was feedback about a personal experience. So that's why I think the difference between 4.5 and 4.6.
Okay, thank you very much.
Okay, I see David's hand up.
Thank you. Could I draw the committee's attention to 4.5, palliative care and end-of-life care is the second highest entry at 231, and at 4.6, palliative care is actually the highest entry at 26. The relevance of this is that, if I recall correctly, palliative care and end-of-life care was one of the 5 priorities that the Cabinet Secretary said integration, joint boards actions would be judged upon at one stage. I know these things come and go, but I'm sure it's still hanging there somewhere in the ether, if not more firmly. And secondly, can I remind the board that during a previous board discussion, there was a commitment made to have part of a development session set aside for a discussion on palliative and end-of-life care in East Lothian and its provision to promote awareness of what exists, how it exists, and the work that's been done, with a view to seeking to see if there might be any improvement in cohesion, not that I see any issues currently.
Do you
Okay.
want me to come back in?
Yeah, could you come back in, please, Laura?
So I don't remember the commitment to do a development session. However, Neil Munro will definitely keep me right on that, and I think that's a good point, because it is something that we need to look at. I think it is an area where we don't perform as well as other areas, and as you can see from the paper, is something that people are concerned about or comment on, both either they've had a positive experience or they could have had a better experience in caring for somebody at end of life. Sarah, our new chief nurse, is tasked with kind of pulling the information together and doing a bit of a research report paper that I think she's hoping to bring back towards the end of January to our project board. I hope I haven't dropped you in it, Sarah, but I think that is correct. And that will just help us inform where we are just now. We'll take the comments that we see coming forward. That'll help inform our picture as well. And then with the information that we've got here, where do we want to get to? What are people telling us that they need in relation to palliative and end-of-life care? So what do we need to invest in, or how do we need to change our processes? So I think that's right. I will make sure or speak to Neil just about when that development session was supposed to be happening, David, because I know you asked me about it in relation to carers in particular, and I think that's right. But I just need to, we need to pull it together, but it certainly is on our agenda and certainly something that we recognise that we're not delivering as well as we could here, and we need to think about ways of improving that.
Okay, does that help to answer your question, David?
Yes, thank you. I think the commitment was about a year ago, and it was supported by the GP member on the board.
Okay, I certainly can look back to that, and we can raise it again because it has come up, and it's certainly an issue. And I know that report that Sarah is doing could help inform that later next year.
Okay, could we take that down as an action point to come back? And I think, Sarah, once you said that you're doing a report, when you think it's appropriate to come back and engage with the Clerks team of a potential development session, because I think that'd be a useful exercise for IJB members to be aware of what the landscape looks like and where the gaps are, and then that work will be picked up through the kind of ageing population work that's happening. So that'd be helpful.
Yeah, so so Neil, I know Fiona, pleased with this. So Neil will coordinate our development sessions rather than the clerks of this meeting. I think that's how it works. And then I think it would be right that the provisioning project have that opportunity to develop that piece of work, and we will come with those recommendations to the IJB, which may well be better being a development session first, as you say, Shameen, and then coming with the recommendations.
Okay, thank you. Do we have any other questions? John?
Just to say, thank you, David. I think it probably was the previous GP representative on the board that agreed with it, but I can say that I agree with it too. I think it'd be an excellent idea and lots of learning to be had there. So happy to support that. Thank you.
Great. Thank you very much, John. Do we have any other questions or any comments? Carol?
Well, I welcome this update because older people contribute quite a lot to the society. They act as unpaid carers, they act as unpaid babysitters or unpaid childcare. And I think that every effort should be made to make their end of life as comfortable as possible. So I really welcome this update. The only criticism I've had going around the day centres is one person said, enough of consultations. When is something going to be done before I die? That is the only criticism I've had. Thank you for the update. Thank you.
Thank you very much. I think it's really, I agree with the comment you made. I think it's really important of when we ask people and we do surveys of the action that we're going to take as a result, and that's really important to go back out. And as Laura has indicated, there's a timescale for us to be able to do that. I think there's been a significant level of consultation, but I think people will always say you've never done enough. But I think as long as we can demonstrate that we've gone as wide as possible to the local community and got as many opportunities for people to give us comments and feedback is really important. It's what we do with that next. Okay, I don't see any other comments or questions. So are we happy to move on to this? This paper requires a roll call. So I'll move on to you, Fiona.
Thank you. The recommendations are as set out in section 2 of the report. And I'll come to each member individually. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Councillor Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Fiona Ireland.
Agreed.
Carol McFarlane.
Agreed.
And Peter Murray.
Agreed.
Thank you. That's the recommendations agreed unanimously.
That's great, thank you. Move on to agenda item number 6, which is the transfer of hosted services to East Lothian Health and Social Care Partnership, and that's a report by the Chief Officer.
Paul's
I'll
gonna
be
take
speaking to
this.
that paper, Chair.
Okay.
Paul Curry. Thank you. The paper in front of you sets out some discussion and outcomes of a conversation between NHS Lothian, the other Lothian IJB HSCPs and East Lothian HSCP. And the paper asks the IJB to note 4 items, which are to note the pressures facing Edinburgh HSCP and how NHS Lothian is seeking to reduce those pressures and to improve Edinburgh's performance through a whole system response from the other Lothian HSCPs. To note the transfer of responsibility from Edinburgh HSCP to East Lothian for the management and performance management of 4 hosted services based in Edinburgh. Now, the list that you have in your paper that came out with the agenda is incorrect. My apologies for that. There is an updated list following clarification, and I will issue a new paper with those services. It's there's no new services, it's clarification. So just to explain that, in bullet point 1, it's now inpatient and outpatient specialist rehabilitation services in the Astley Ainsley Hospital in Edinburgh for amputee and neuro rehabilitation injury. It's the cardiac rehabilitation service, also in the Astley Ainsley Hospital, not the heart manual, as is said in the paper. And it's also the inpatient and outpatient specialist acquired brain injury rehabilitation service at the Robert Ferguson unit in the Royal Edinburgh Hospital, also in Edinburgh. And finally, the specialist sexual health service in the Chalmers Centre. So that will be clarified in the paper that I will issue following this meeting. My apologies again for that incorrect information. You're also asked to note that line management for senior staff in the services listed above will also transfer to East Lothian HSCP so that the partnership has full control over those services. And lastly, you're asked to note that it's intended to complete the transfer of the services by March 2024, though if that can happen sooner than that, we will update the IJB, and there will be transitional management arrangements in place in the run-up to this date. Now, just for clarification, we're talking about hosted services. At the bottom of page 1, the footnote explains what hosted services are. And these are basically services that are operationally managed by one HSCP on behalf of 2 or more of the other areas. For example, the dietetic single system team is managed within Mid Lothian HSCP on behalf of all the IJBs. So we will be running these services on behalf of our colleagues in the other partnerships, and we will be responsible to them in terms of our performance and achievement of targets and such like. The paper gives some background, describes the reasoning behind Edinburgh asking for changes to its hosting responsibilities, and these are around pressures on trying to vacate the Liberton Hospital site. The thinking is that if this set of services moves from Edinburgh, they will have the management capacity to develop the Liberton Hospital site and to address other challenges in recruitment and retaining nursing staff and in addressing financial pressures and performance challenges. There's been a fair bit of discussion between the NHS Lothian executive team, Edinburgh ELHSCP and the other partnerships to try and agree an outcome. And the outcome of all that was that we were asked as the recipient of these 4 services to take on responsibility and to, as I say, report to the Health Board and to partners on that. Now, in point 3.10, there's a slight error in that paragraph. The performance monitoring of the services in the transitional period and once complete will be to East Lothian HSCP, not East Lothian IJB, as I originally put in the paper. And that's because it's an operational matter which requires us to work with and report to NHS Lothian core management team and the other Lothian HSCPs. There's been a fair bit of engagement internally between the partners in this, between Edinburgh, NHS Lothian and the other 3 HSCPs, and staff members who are affected by the changes have been consulted with and are being fully involved in the changes. There are no implications for staff foreseen, apart from a change in line management for some senior members of the respective teams. And for the same reason, we don't expect there to be any implications for patients from the changes. Therefore, we don't intend to have an impact assessment carried out in the service changes. It's simply a matter of management lines. It shouldn't change the services that patients receive. The last thing I would make in ways of correction is to say that there are in fact no policy implications. On reflection with wiser members of the IJB, it's been agreed that there is no policy implications, that the suggestion in the paper that there needs to be an amendment to the IJB strategic plan for the current period is incorrect. The hosted services are on a list that is updated occasionally according to operational matters. So it's not needing any IJB strategic plan changes. There are no requirements for directions from this change at this point in time, though there may be some in the future once the East Lothian HSCP management team has got its handle on the services. There may be some changes they wish to take forward, and they will be directed towards partners as necessary, and the IJB will be informed of that. And lastly, the resource implications are still in discussion. The table on page 4, table 1, describes there being a requirement for H whole-time equivalent posts. At the moment, there's no final detail to include in this table. There will be an update once the agreement is reached on the resourcing requirements for these posts, but there will be at that point a share commensurate with the usual share that East Lothian HSCP pays towards hosted services of, I think, 12.5%. But David King is waiting in the wings and we'll be able to give more information on that if so required. So, as I say, the request to the IJB is to note the 4 actions at 2. Thank you.
Okay, thank you, Paul. Do we have any questions? Fiona Ireland.
Thanks, Paul. I was going to ask about the funding, and I suppose I hear what you're saying about that would be on the normal share between the partnerships, but I do think that we need to be very clear in East Lothian that we are not landed with costs as a consequence of this, and that we as an IJB we would be paying our share. Presumably we were paying our share into this anyhow, and therefore our share is already our share. So we need to make sure that that is fully funded. However, in generality, I think this is a really good opportunity. I think it's the right decision. I think East Lothian over the last several years has proven what it can do around rehab and how well it can do around flow, and it makes a lot of sense for East to be the host partnership for this.
Thank you, Fiona. I have David and then Elizabeth and then Andrew.
I was going to ask also about the financing of the transfer. First of all, I would say I do support it. I think mutual aid in times of difficulty is a very sensible thing. But am I right in assuming that this is a kind of permanent, or as far as permanent can be, it's not a temporary proposal? Secondly, I have difficulty understanding 8.1. Responsibility for management of the current personnel, management and financial resources for both hosted services will transfer to East Lothian Health and Social Care Partnership. What is the management of the management, and what is the both, is the question.
I'll come back. It's for hosted services. Managing, it's a clumsy sentence. It's basically managing of all of the aspects of the service, the personnel, and those resources that are required for management and financial purposes across the 4 services. So yes, I'll ensure, David, that when I produce the corrected paper, I produce something that's better lined up with proper English in 8.1.
Okay, thank you.
Does anybody want to come in about the management structures that David picked up? Fiona?
Yes, so it's essentially it is a change of line management for many people. So David Hood will manage Chalmers and sexual health, and Gillian Neal will manage the rehab services. With that, there is clinical managers in place, which I think what Paul was trying to say, managing the managers. So it's around that line management, but within that, because Edinburgh are keeping their general manager, we need to make sure there's proper governance and line management that supports both David and Gillian, but also supports the services. Hope that makes sense, David.
David, does that help to answer your question?
It does add a bit more understanding, thank you.
Okay, thank you. And the other one was that from the paper, it looks like it comes across as permanent, but I don't know whether this is a temporary for period of time or a permanent arrangement.
So that has been discussed, but the intention is that it comes across as permanent.
Does that help to answer all your questions, David?
Yes, thank you.
Do you think, Elizabeth?
Thanks. Something I just wanted to raise. I think NHS Lothian Strategic Planning Group are currently working on a women's health plan, and it's Rebecca Miller doing that. And there's definitely aspects of that. It's obviously still in draft, so I don't want to say what the content is. But there's obviously stuff in that that's very relevant to Chalmers, and I just wondered if somebody within East Lothian, David Hood, will be linking up with Rebecca Miller to discuss the points they've found about women's health that relate to Chalmers. Thanks.
I think you said me, Shameen, your mute was on. So yes, and absolutely, I was at the same board meeting of that really interesting presentation from Rebecca Miller. Rebecca Miller has also reached out to us in the partnership, and we will be picking up on that. And actually, what we got at the board meeting was even more, I think, than we'd had through the partnership. So absolutely stuff to do there. So thank you.
Okay, and I have Andrew.
Yeah, it's kind of just a repetition of the points made. Fully support it, an endorsement to Fiona and the team of capabilities and competence in this field. So yeah, well done there. But just a reassurance that this won't impact upon the work of East Lothian IJB. I know you've given it before, but it's always useful to have it again, just for the board.
You want to come in?
Yeah. No, absolutely. So we are being supported by NHS Lothian, and I suppose I just want to reiterate, and similarly, we just had a kind of joint partnership forum earlier. I think this is a great opportunity for East Lothian with our I hope with our credibility around performance, with our big interest in rehab and the stuff that we do. I think it allows us to influence it in a way for rehab services and Chalmers sexual health where we perhaps wanted to in the past and haven't been able to do so. But importantly, we recognise that we want to support the staff who are doing a brilliant job in there already, and just really increase the profile there. And I've already started discussions around kind of what they would be looking for as well. So if that gives you reassurance.
Yeah, thanks, Fiona.
Okay, thank you. I just wanted to ask, you'd mentioned there was many people going to be involved. Could you maybe say how many are going to be transferring over to East Lothian Health and Social Care Partnership? And some of the points have already been made around making sure I think we've got a track record of being a very high performing health and social care partnership and making a contribution to the region and supporting our partners. And that's usually been done looking at with the capacity and the resources that we have to make sure that we're able to be as effective as possible. But just to be reassured that the full complement of the management team will be in place, because we want to make sure that the current staff there are able to continue delivering the high quality services and the outcomes that they're currently delivering. And if there is any overspends, who will that lie with if this is going to be part of East Lothian Health and Social Care Partnership?
So the overspend will not lie with the IJB, it will lie with the ELHSCP, but that link to NHS Lothian. I think there's nearing 300 staff that are transferring over to us, from what I recall from writing job descriptions. And absolutely, I guess, agree around that, getting it right around that management structure. And we've put in place a kind of set of options, what we think we need just now, but of course we're going in there still learning and understanding. So these posts are going through job evaluation, what we think we need that supports David and Gillian. I think David and I are really thoughtful around somewhere like Chalmers, that while what we think we need, is it the right thing given the kind of financial situation of organisations and just getting best value. So but part of the delay of where we thought we might be of transferring earlier around the rehab, Chalmers has transferred the rehab, is around kind of job evaluation, and we want to just make sure that we're both organisations, both Edinburgh who are handing over and East are supportive. I suppose I've got the right structure in place to be able to do that from a safety, a quality, and doing the right thing for staff, but also for the people we serve. And I think you're right to note around that wider impact around Lothian. We've done it with Ward 5 around the stuff we've done in East and the impact for Lothian. We want to do the same around Chalmers, and also kind of rehab services, because I think there are opportunities there that maybe have not been taken in the past. So looking forward to it.
Okay, and just one final, there was a question asked around that we pay 12% towards our hosted services. Well, it'll still be 12%. It won't be 24% if we're then having to be the host, or it'll still remain that level.
No, that is probably as a bit of a red herring and all. So it'll still be the same as we do around other services, our share. So that won't change at all.
Okay, thank you. Do we have any other questions or comments? I don't see any other hands up. I think on this it's a really positive move, but I think it's something that we do need to make sure that as an IJB we're reassured about, ensuring that the current managers there have the right level of support, with the team that you have, Fiona, you've got the right level of support to be able to take this forward, and we want to just make sure that we've got reassurance of that, and just reassurance of we understand that will make a difference to Edinburgh Health and Social Care Partnership, but we also want to make sure that they deliver positive outcomes. We also want to make sure that our positive outcomes also continue as well, that we don't start going into a opposite trend, and that's important. So if there's a way of having a feedback or a review or an update of when you think it's appropriate, but especially around any updates of ensuring that the full management structure is there for you to be able to take this forward effectively. So you've mentioned March 2024 is when you believe all of that will be in place.
Yeah. So we're aiming for that as the kind of the latest date, but I think and we probably should be given we use this, we can bring an update as to kind of progress and just for noting to the IJB in the future. But yeah, March 2024 for the date of handover at the latest.
Okay. I don't think we've got any other questions or comments. I don't see any other hands up. I think we've had a good level of discussion and debate, and I think Fiona's got a good idea of the kind of things people have mentioned of ensuring that how we move this forward. So we'll move on to this doesn't require a roll call because the paper is just for noting. So if we're happy to note that. Agreed. Okay, thank you. Move on to paper number 7, which is the delivery of medical adaptations in the private sector, and that's Wendy Maguire.
Thanks, Shameen, and
Wendy.
afternoon, everyone. For those who don't know me, I'm Wendy Maguire, Head of Housing. Thanks for inviting me along today. I understand that you've already received some updates in relation to adaptations, so apologies if some of this is repetitive. I think there was a bit of confusion about who was bringing this report to the IJB, so apologies for that. And also to say, since I've circulated the report, there's a couple of updates, one to section 3.6 and another to 8.1. And I'll provide that verbally today and update the report for circulation with the minutes if that's okay. The report's quite long, so I'll try and keep it as succinct as possible, but the purpose really of the report is to update the IJB on the ongoing risks and challenges associated with the delivery of adaptations in the private sector, and also just to update you on the risk-based approach that we're taking and the actions to inform and safeguard those critical cases. And how we're keeping residents informed. The recommendations of the board today is really to note the ongoing challenges as a result of the budget being committed for the remainder of the financial year, and to note the legal position and the responsibility of where adaptations sit. And also recommended to note the updated position and actions being taken to keep our residents informed. And there was the letter that went out to residents was attached. And finally, really looking for the IJB to agree, to the way forward, the next steps, the short, medium and long term options that are set out in the report, and really to ask to take a lead, I suppose, in terms of taking, carrying out a best value review of the service to identify improvements and ensure good governance and effective management of resources going forward. So just briefly then, in terms of a wee bit of a background, I think everybody is aware, adaptations to homes have many huge benefits that can help people live independently, enable people to remain in their own home for much longer, prevent hospital admissions, and also allow for early discharge from hospital. Adaptations are split into 3 different elements. So you've got equipment, minor adaptations and major adaptations, and this report is very much focusing on the major adaptations, and that's for things like wet flow shower installations, widening of doors, like more of the sort of structural works associated with adaptations. In terms of the legislative context, this is where it becomes hugely complex, so I'll do my best. I've tried to take some advice from our legal colleagues as well as Scottish Government, and it's not been easy. So as from everything that the team have read and from conversations that we've had with various people, the legislation context in relation to the delivery of major adaptations, like I say, is complex, and it's changed over the years, which hasn't helped. But it's the Public Bodies Joint Work in Scotland Act that establishes that legal framework for integrating health and social care in Scotland. And that act requires the Health Board and local authority to delegate some of their statutory functions and associated budgets, as you know, to the integrated authority. And the key responsibilities delegated to the integrated authority in terms of adaptation is the duty to assess for an adaptation, planning for and resourcing adaptations, and the duty to provide grants of 80% or 100% for those living in the private sector who are assessed as needing an adaptation. But on top of that, local authorities also have powers and duties under the Housing Scotland Act to assist homeowners in certain circumstances, and that includes assistance to adapt the home for a disabled person. And again, there's been various changes in legislation over recent years But this is the most recent change includes a system of financial assistance with those major adaptations, which attracts that external funding, which is a mandatory grant of at least 80%, apologies, for the cost of the work, and 100% for those applicants in receipt of certain income replacement benefits. So that's a very sort of high level sort of summary of the legislative framework. Like I say, it is quite complex. Over recent years, I think since 1993, the council have been sort of have an agreement in place with Care and Repair East Lothian, who currently support the delivery of major adaptations in the private sector. Like I say, the first set up in, I think, 1987. And we've had that local service in East Lothian since 1993. Now, we've got a service level agreement in place with Care and Repair, and that service offers, major adaptation service for all disabled children and adults who are homeowners or private tenants. And they really facilitate all of these works. So when assessments made, and recommended, that usually goes to Care and Repair. Care and Repair then facilitate that by helping owners, bring in contractors, architects, etc., and help to provide that sort of advice and support throughout the work. And then normally that invoice will then come into East Lothian Council. It comes in currently to the housing team, and the housing team will approve that, and they then invoice. They then pay the invoice to Care and Repair. The funding at the moment, so the funding's made up of private sector housing grant, which we get from the Scottish Government. But now that's an annual grant, and we'll not know what next year's allocation is going to be until about the 21st of December this year. So it's really difficult. It's an annual allocation. It's really difficult to plan ahead when you don't know what the future allocation is going to be. But roughly, it hasn't changed that much over recent years. So it sits at about 464,000. But on top of that, East Lothian Council, through General Services account, make a further contribution of 256,000. That brings us, gives us a total of 720,000. And you'll see in table 3.5 of the report that, how that is allocated. So there's just over 300,000 go to Care and Repair themselves. There's 363,000, nearly 364,000 to that comes from the private sector housing grant for the actual adaptations. And there's internal charges, and that was because we used to have a private sector housing officer, part-time private sector housing officer. That post's actually been vacant for about a year and a half now, which has actually given us a wee bit more flexibility this year, albeit it's only for 26,500. Like I say, 3.6 is updated since the report was written, and as of last month, we are our total projected spend by the end of the year is now sitting at 367,497. Now that is over the private sector. That is over the private sector housing grant allocation. And like I say, we've got a little bit of flexibility because we've got that vacant post at the moment, and we're using that money to cover the overspend. But it's hugely concerning. And the team are confident. Some of these projects are currently in pipeline. They're all committed, but the team are confident that we will spend that budget before the end of March next year. So, like I say, the key challenges then that we're experiencing, are that, we've still got, Leslie and the team can maybe come in and supplement some of this, but, we've still got huge demand. It's a demand-led service. It's really difficult to plan. And we've had to take some very short-term approaches in how we deal with the cases coming forward. And we've got a risk-based approach with actions being taken to inform and safeguard those critical cases. So and I think, Leslie, you've already updated the IJB on this previously, but that's resulted in a review of tightening sort of the prioritisation around that risk-based approach. And we've got things sort of RAG rated, I suppose, into critical, substantial and moderate. Leslie's also created a panel to assess those critical cases and the more complex cases, and looking at the impact that those, by not doing that adaptation would have on the person. Like I say, we've informed residents. That has created quite a volume of, you know, inquiries coming in and real concern from residents, as you can imagine. But in the meantime, we are looking, Care and Repair are still very much delivering, and we are just updating the service level agreement that we have with Care and Repair between now and the end of March to see if Care and Repair can maybe, you know, deliver things slightly differently, maybe look at opportunities to try and secure additional funding from elsewhere. So that's the short term sort of steps that we're taking. I think in the longer term, I think it's quite clear that we need to carry out a review of the adaptation service and a review of maybe the Care and Repair service and how we deliver adaptations going forward. So it was my recommendation that, you know, that the IJB, you know, looked or agree that we carry out a best value review of the service to identify those improvements and, like I say, and ensure good governance and effective management of those resources going forward. I do think, given, you know, where it sits in terms of its delegation, that would be better led by you know, health and social care. However, I do very much, given the legal complexities and around this, I do very much agree that it should be joint led, and I'm happy to do that and take that forward with colleagues. Maybe just to give you, like I say, Leslie, I know Leslie's put a panel in place at the moment looking at critical cases, but Leslie, we are now, you know, fully committed and slightly overspent, which is a real worry. And I'm not sure, again, I mean, I think that panel, if I'm understanding correctly, is really looking at the assessment and what we could maybe do differently there. But I'm not sure if this is also going to assess, I suppose, the financial and the human impact of not doing that adaptation, you know, and I do think that's really, really important in terms of, you know, the impact that it can have. It's like I say, it's not just financial, and that financial impact can be on the health and social care budget, and it could also be on housing's budget. And I think we need to, you know, look at that carefully. Just to give you a sense as well, I went to visit a tenant actually on Monday night with our housing convener, and I actually think this may be quite a good case just to give you an example. But when I went to visit the tenant, you know, the husband has been discharged from hospital. His house is not suitable, and we don't have any money to adapt the property at the moment. He's living in his living room, beds in the living room. It's quite a small property, beds in the living room. There's a commode. There's carers going in 4 times a day to help with washing and toileting facilities. The wife is really distressed, and it's really impacting on her mental well-being as well as the husband's mental well-being. They're embarrassed to have people round and visitors round, so they're struggling to socialise as well. You know, suggesting, you know, all sorts of things about, you know, the possibility for rehousing. Again, you know, understanding the challenges there, and that they're pensioners, you know, it's a huge upheaval. I think she suffers from arthritis, big upheaval to move, don't have money to carpet and decorate properties either. And they've also got, you know, their support networks in place in that particular area. The solutions, however, for them to remain in that property would be the installation of a curved stair lift, and potentially a wet floor shower, which is not ideal for that house either. But I think, you know, in cases like that, I think we need to be, you know, reviewing that and looking at the impact and whether or not, you know, paying for some of that work to be carried out would, you know, in the longer term have a financial benefit, I suppose, to housing in the longer term, and the health and social care's budget in terms of maybe reducing the number of carers that are going in every day, because that person would then be able to get to the toilet and wash himself as well. So again, that's just an example, a case that I wanted to share with you. Yeah, I think that's me. I'm happy to stop there and take any questions. Like I say, I've got Leslie and Fiona. Fiona's had her hand up for a wee while, so sorry, Fiona, if you want to come in and correct me on anything there, but I'm happy to open up to any questions to me.
Okay, thank you, Wendy. Do you want to come in, Fiona? I think Leslie, you had your hand up as well.
Yeah, I guess a couple of questions from me. And just really, well, one comment to start with, just working with Wendy, we know there is a challenge. My understanding, Wendy, the budget's capped, so we shouldn't be overspent, that there's a pressure from an HSCP, because I know Claire Flanagan was very clear with finance, so that budget should be capped, there shouldn't be an overspend. My question is when we've gone back to care and repair, has that gone through a competitive tender for care and repair? Because are they the right people to do it, just as that part of that process? And I suppose your kind of example around the person-centered approach, there is a bit around realistic conversations and what we can and what we can't do. And I think as, and I say this with a professional background, we can't do everything for everyone. We need to really focus on what we can do, but also have the conversation. Sometimes we need to explore looking at alternative and a choice of moving house. And I say that having gone through that experience on a personal level with people, that actually it's not the responsibility to put in adaptations. The decision is to work with people to say, actually, we make a different decision around moving accommodation. So I suppose it's just getting the balance in that. I suppose the other point is that this will come out of the schema delegation next April, that it is coming out around the private care budget, is my understanding. So it's our responsibility till the end of March rather than beyond some of the funding of this. So I think it's just important to note that, as well as all the work that's gone in. It'll come under the council budget.
Okay, can I come back in, Shameen? Is that okay on that? So there's a number of things in there, Fiona, and in terms of care and repair and how they're procured, that is something that needs to be, explored through the best value service review. Like I say, care and repair seem to operate across a number of local authorities, and I need to better understand the history behind that. They've been in place, like delivering the service, like I say, since 1993. So that will be part of that best value review going forward. In terms of the delegation, I think that's something that would take offline, because that's not my understanding, and that wouldn't align with the legislation either. I think HRA adaptation slightly differently, because HRA is very much ring fenced, so I can maybe understand that for the council adaptations, but my understanding for the private sector ones, that would remain under the delegation of the IJB, just because that's how legislation is set out. But I may be wrong, and I'm happy to take that offline and have a look at that. And like I say, whether it sits under the IJB, whether it sits under the council, I don't think it matters. I think it's a joint approach. I think we need to be working together around that messaging at assessment time, around, the impact that it has, like I say, not just on budgets, but on the human impact too. You'll have heard this morning at PPRC, some of the housing pressures that we have just now as well, and we just don't have suitable housing and the right accommodation. We've got a real shortage and a real housing crisis at the moment as well. So I think that there needs to be a balance, and I'm hoping, like I say, Leslie's got that panel now up and running. And I'm hoping that we can maybe have some of those wider conversations there now that, Leslie, we're now at sort of over committed on the budget. And just on that as well, Fiona, sorry, just to reassure you, yes, there is a cap on the budget, and yes, we are slightly overspent by about 4,000, but like I say, we've got flexibility in the 26,000 because I've got a vacant post, so we will absolutely be keeping it within that 26,000 flexibility that we have there. But I do stress that when we reach that cap, and it's really difficult to prioritise when it's demand led, because people are coming, you don't know when a case is going to come forward, and I just want to stress the importance and the impact of not going above that budget, and that the potential or the risk of increased costs in other budgets, which potentially might be even more than not carrying out the adaptation, if I've articulated that well. Thanks.
Yeah, you have, Wendy. You understand the longer term impacts if we don't do that. And you've talked about the individual at home in a hospital bed. What's the likely chance of them ending up back in hospital where that's not where they want that's the last place that they want to be, and that's where the last place the health service wants that person to be in either. Okay, I've got Leslie, and then Carol, and then Elizabeth.
I just want to come in and say yes, thanks, Wendy. We have got a committee started off which is very clinically based to look at the clinical needs of the individuals and also their well-being. But I think that what we have discovered, I think Maureen was saying the third sector do have funding available. I think we go by the assessment of the professionals to say what is the art of the possible. Sometimes that conversation could be improved with working with care and repair or whoever is successful in that building management. So we can look at what that person functionally needs, but it'd be great to have support to look at what building wise is possible. And I think that when we come to a situation where we are putting a lot of work into a house and it's still not going to meet that person's requirement, then a very supportive conversation with the individual to say, if you want to remain at home, this is not the house for you, the home for you. And I know housing is really short and people would love to stay in their own home, but sometimes it's not physically possible to keep them as safe as possible. So I think we're looking at what is the art of the possible to prevent people going to hospital, to support people staying in their own home, and looking at that, the clinical risk there. And we're doing that very successfully. But I think we need to be very practical and use as many expertise as we can to look at physically in that property, what is possible and what isn't possible. So I think it's that balance we've got at the moment, which we're looking at. Finances, the cost of doing any adaptations at the moment have risen so high in the last couple of years. It's breathtaking, and I think we need to take that on board, that it's had a huge effect on everybody's budget, especially this one.
Okay, thank you, Leslie. Did you want to come in on any of that, Wendy, at all?
No, I don't think so. I mean, I think we do that in terms of the housing side as well, Leslie. I think we maybe just, it's maybe another conversation for the next panel, you know, because like I say, we're now at maximum sort of capacity in terms of the budget and there's no more flexibility. So the next case might be a really good one to explore in that manner. And in terms of third sector funding as well, Maureen, I don't know what that funding is, but again, you know, that's something that we are looking to explore with Care and Repair as well in terms of their role going forward, particularly over the next 3 months, just to see what other funding is out there and what other funding that they can maybe secure to help.
Okay, thank you, Maureen. Did you want to come in? Yeah.
I just jumped in there, Siobhan, sorry. I think, Wendy, there's something about the income maximisation that is really key to all this, because I mean we work alongside Leslie and others to do that for individuals, and actually sometimes the back money awards are quite substantial and they should be used, you know, to support the changes that need to be made. But I'm happy to have another conversation out with this meeting with whoever.
Yep, that'd be helpful, Maureen, thanks.
Yeah, no, thank you. I think in the last minutes of the last meeting, there was a note of looking at other potential support from the voluntary and community sector on this area. So that's really helpful. Carol, Elizabeth, and then David.
I've had a lot of constituents, including myself, who living in houses that we can manage at the moment, but which would cost an awful lot of money to adapt. And we wonder why private developers are not building 1-bedroom and 2-bedroom bungalows that would be easy to adapt. We would sell our houses, we would move into the house, it would be easy, and the council would not need to pick up these massive adaptations that they're having to do, and nothing's really been done about it. So I'm just asking if that would help the council with the amount of money that they've got to spend, because I've had an awful lot of constituents wanting private developers to build that type of housing.
Thanks, Carol, and I'd agree. It's a growing concern. You know, our demographics are changing. You know, we've got probably the highest growth in terms of that older population, and it is a real concern, even within our own stock. And again, we're trying to look within our own stock at the moment to see, you know, when a property becomes void, is it suitable to do that adaptation work, you know, at void stage as well, and try and increase, you know, the the type of properties that we have for, I suppose, sort of lifetime homes. In the private sector, yes, absolutely is a real concern and not something that I have any control over. However, a conversation that we've been having with our planners, you'll all be aware that we're currently just developing the next local housing strategy. Now that local housing strategy covers all tenures, and that is an area that we've picked up through the strategy, and we've got some evidence in terms of need. We've done an older person's needs assessment as well, and working with our planners. I know the Scottish Government are really keen to see a target in the next LDP, you know, around you know, a requirement for wheelchair houses, for example. Now, again, I don't know how we enforce that. I don't know if the planning authority will have powers to do that, but that's certainly something that I'm exploring a bit further with our planning colleagues.
Okay, thank you. Does that help to answer your question, Carol? Okay, thank you. I've got Elizabeth and then David.
Thanks. My question was just in light of the severe budgetary constraints, does the council already work with care and repair to try to repurpose equipment such as hoists and maybe lifts when they are no longer required? For example, if the person goes into a residential care home, I was just wondering if there's any more further scope to save money that way.
Yeah, thanks, Elizabeth. That's not my area, and I would say that was equipment and equipment that can be reused. Is my understanding is that would be reused, and that comes back into the social work department. But yeah, I mean, again, just on that, just because you touched on sort of the hoists, etc. Again, another, I suppose, area that we're looking at, particularly within our own stock, because we can, is that, you know, when we're building new properties, for example, we're putting in, you know, some reinforcement, you know, in terms of the ceiling, you know, the joists, etc., so that they could take track hoists a lot more easily without that, to try and reduce costs going forward. That saves quite a bit of money structurally as well. So trying to be a bit more forward thinking that way. But so in terms of equipment, yeah, that's not my area, but my understanding is that already happens and it's reused.
Okay, did you have anything else, Elizabeth?
No, I didn't, thanks.
Okay, thanks. And David King.
Thanks very much. Just a few reflections, actually. The technical issue of, is it part of the HRA and therefore is it going to come in and out of the delegation to the IJB is absolutely a technical issue. We'll get that sorted out. Wendy makes a really important point about the whole point of the IJB and integration is everybody's working together, and we all know there's an awful lot of things out with health and social care as such that reflect people's life choices and people's ability to live well. I think an important thing to remember, however, is that, you know, we're a planning board, and it's really useful to have these kind of discussions. And this is the kind of thing we need to factor into our planning, but it's the kind of thing that needs to be sort of pumped through the strategic planning group and then back into the IJB. And I absolutely accept the whole point that money spent in one place can, of course, create benefits in other places, and that's me save money spending. So I certainly have no objections to any of these things. We've talked about best value, we've talked about value for money. I think these things are terribly important. So I just thought this was a very interesting conversation and sort of joins quite a lot of these bits together.
Thank you, David. Do we have any other questions or comments? No, I don't see any other questions. So thanks very much, Wendy and Fiona, for the paper. I think it's really important that I know the cost of adaptations is going up, but the cost of somebody going back into hospital or not being able to live at home with dignity or respect, or more likely to end up in hospital, the cost is far higher for the system. It's not good for that individual, but the cost is far higher for that system. We know, having asked the question of how much does it cost for one day at the community hospital, and it was roughly £350. I think that was the ballpark figure I was given. So I think around this is kind of as a strategic board would be that as part of integration, that panel, it looks like it's just looking at the clinical aspect of the case, but how do we make sure that everybody is around that table, that we're looking up in a truly integrated way with the main focus of getting it right for that individual that individual that the case that you've given, Wendy, is able to stay at home and doesn't end up back in hospital. On one of there's a number of recommendations in here, but also there's next steps at 3.9, and I think one of the really important sentences in the key steps is around the importance of taking a corporate approach, maybe that's the best language to use, and health and social care and housing working far more closely together. So my suggestion would be, and also writing to the Scottish Government, because I know that's going to be happens around about December time, to give them an update of what levels of adaptations have happened, what else is in the system. I would recommend that we place 3.9 as a recommendation in that paper to come back to say, well, look, we will definitely write, and we take as much evidence base as possible around this issue. And when we did discuss it at the last IJB, I think it was Marilyn that had said we needed to carry out an integrated impact assessment on this area of work, and if we're able to do that in any aspects of that could be included in the letter to the Scottish Government that helps our case, would be helpful. And I think we've got to always remember that we are one of the fastest growing authorities in Scotland, in the top 3 for especially in the growth for older people. And we very strongly made that point when the Scottish Government Cabinet came to East Lothian, that we're doing a huge amount to support people in a system that's struggling, but if we're not fairly funded, we will not be able to continue maintaining that as we move forward. So we made those points really forcefully and clearly to them when myself and Councillor Hampshire and Councillor Jardine, who's also on the IJB, met with some of the ministers of the importance of being funded fairly to enable us to support people, and also we're making a big contribution to the programme for government. Okay, I've got Fiona Wilson and then Fiona Ireland.
Hi, just coming back in, Shameen, on your comment about that holistic view, just to give assurance, Leslie presented this at the last IJB. The panel is doing that on a individual basis each time with a set of a kind of multi-professional approach. So we are doing that. So just in case there was any doubt by anybody in the IJB, that is already happening.
Okay, that's helpful. I think it'd be helpful if there's any other options, any other funding opportunities that might support that family or that individual. I think it's, I don't know if VSEL involved, but I'll leave that with you just to make sure that we're looking at all possible opportunities to get the best outcome for that individual.
And I think Care and Repair, that's part of their role, Shameen, which was part of my question, that they would look at other opportunities as well, not just about funding. So I think it's just picking it up, but absolutely.
Yeah, and I was just going to come in and say that, you know, that is Care and Repair's role as well. And again, we're updating that service level agreement to make sure that they are exploring all avenues. What I would say, that case that I was given an example of, that's actually a council tenant, you know, and just because I went down with a housing convener, and it was just an example to share with you. And I'm not saying that we need to, you know, adapt that property. I'm just giving an example of the impact that's having on that person, and the risk, I suppose, in terms of not adapting that property, and the risk to health and social care if that person does end up having to be readmitted into hospital. So it's just trying to find a solution that works for everybody, and being mindful of the deterioration and the health and well-being of both individuals. And this is happening across. It's just one probably very small example. You know, this is happening right across the sector in all tenures.
Thank you, Wendy. I've got Fiona Ireland and then Leslie Berry.
Thanks, Shameen. I think we need to be really careful. It sounds to me as though we're straying into operational territory here, which is the first thing we need to take a step back from. However, in terms of the paper more generally, I think as the IJB is responsible for strategic planning, I think what we should propose is not that we have the debate here in the IJB, but we actually take this to the Strategic Planning Committee and have a thorough discussion about it. It's totally inappropriate for us actually to be having this out in the IJB, I think, without it having been to strategic planning.
Okay, thank you. I've got Leslie Berry.
Going to assure you that the committee we do have, but that is operational, and I agree with what Fiona Ireland said, so I won't go into the operational component of what the clinical and the committee that we have, but I will happily discuss it at the strategic programme board.
Okay, thank you. I think we're just commenting on the paper that's been given to us, so we're happy to pick that up. I think it's really, the recommendations are important, and I would suggest putting 3.9 as one of the recommendations in there as well in the next for the next steps. Okay, I don't think we've got any other questions or comments from anyone. Okay, so for this one, we'll require a roll call.
I think Fiona Ireland wanted to.
But before we go to a roll call on the recommendations, I think we just need to take a step back and have a discussion on the recommendations before we roll call them, because I actually think that the fourth recommendation takes us away from the opportunity to take this to strategic planning by agreeing the short, medium and long-term plans. So I think we need to perhaps take a step backwards. I'd welcome other people's comments on that, but my view is we need to take a step back and take it to strategic planning.
I support that, Fiona.
I'd welcome that as well.
Yeah, I think that's a sensible approach, because there's so much to be thrashed out with this. I think Fiona's point's very fair.
Okay, Andrew?
It's just, I'm sorry, I should have put my hand up to agree with Peter and Fiona. And we're adding things to it. I'm slightly lost now with what we're agreeing to with adding new things. So I think Fiona and Peter, I support the view on that.
Okay, I'd be happy to. So what suggestion is that we so for today, is there any of the recommendations that are of a matter of urgency that you do require the IJB to agree today? Are we happy to take the whole paper to the next strategic planning group and allocate ourselves a good amount of time to go through this in more detail? I just want to check that there isn't anything in there, Wendy, as that's a matter of urgency for you to take any of this forward.
There's not, I was invited along to present the paper just to outline the challenges. Okay. So I think everybody can note the challenges and the ongoing risks. In terms of the longer term, recommendation, it is a longer term recommendation. I'm looking to carry it best value review next year. So yeah, I'm happy to take that to whatever group it needs to go to have a fuller discussion, as opposed to getting agreement today on that one.
And just want to check some of those next steps will still happen. It's not the next steps.
Noting that the short-term steps are already happening, and I'm sure Leslie's updated on some of that at previous IJB.
Okay, thank you. So what we'll do for today is take a note of the paper and take an action point that it goes on to the strategic planning group for the next meeting.
Chair, I think in terms of our governance, what we can do is we can get if someone wants to propose and someone else second the removal of 2.4 from the recommendations, and then we can vote. If that's agreed, then we vote on the amended recommendations, which would simply be 2.1 to 2.3, which are all for noting.
Okay.
Is there any voting member willing?
I'm happy to propose that we remove 2.4 from the recommendations.
And is there a seconder for that?
I'll second that.
All right, Jeremy, thank you. So I'll do a roll call vote on the proposed amendment to the recommendations. That's the removal of 2.4. So Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Fiona Ireland.
Agreed.
Carol McFarlane.
Agreed.
And Peter Murray.
Agreed.
So that's recommendation 2.4 removed, and the other recommendations are for noting. So are members happy to note those three recommendations?
Agreed.
Yeah, that's great.
Agreed.
Okay, thank you. Move on to agenda number 8, which is the finance update, quarter 2 review. And that's from David King. David, are you still on the call?
Many apologies. I just had to nip out for a second and do. Sorry about that. Yes, we've got on to the quarter two review paper. I do apologise. You'll have read the paper. And I just feel that one or two things I would just like to clarify, because this paper and the next paper sort of hang together and the points follow on from each other. So obviously the headline is that the quarter two position is still extremely challenging, although it's better than that forecast at quarter one. Excuse me. And I do comment, of course, that the management teams are all aware of all these things. I know it's December, but they have been aware of these things for a considerable amount of time, and there's all sorts of recovery plans currently ongoing. I then talk a little bit about the difficulty of forecasting the social care position. And I sort of explain why that is, because, of course, it's been delivered by third parties. There's all sorts of commitments that are going into the future. And it depends very strongly on the quality of the information being recorded. And it is not a simple task. And colleagues, finance colleagues in East Lothian, the management team have spent years working on this. It is not an easy thing to do. But I am very anxious that perhaps there is an underlying financial pressure in the system now. And I've explained a little bit why this year is different from last year, because we had a significant amount of money from 21-22 and the 20, let me get this right, the 23-24 settlement was different. So you can read what I've said in the paper. So it looks to me from sitting here that there is an underlying financial pressure in the social care position, and that is unusual because up until now it has generally broken even, and so one can simply move on from a sort of flat starting base. And we'll come back to that in the next paper. Within NHS Lothian, there's further funds being made available, as I've said, to support the prescribing position. Excuse me, sorry. And it now looks like the pressure in the health part of the system is largely set aside. Now, as I mentioned, the whole way that set aside is reported and the whole way that the stuff delegated in there is coming down to the IJB is also being considered. So we'll sort of let that work its way through. I then have a very terse note about reserves, and I read it again this morning and thought that this is not very useful. I talk about reserves, and I use that term to mean several different things. That's extremely bad in terms of laying out what's going on. There are effectively two classes of reserve. So we will get money to run our project. Now that project will take maybe 2 or 3 years. So you carry the money from one year to the next in order to pay for it. So over the life of that project, the funding that we've had for it, regardless of when we got that funding, will pay for the project. That is relatively straightforward. As part of that 21-22 settlement went to 22-23, and therefore it's come into 23-24, there was additional funds given to the IJBs for care at home. Now, an awful lot of that money, the vast majority of that money, was used to pay for pay awards and to invest in new services, etc., etc. But some of it has been carried forward into the current financial year and is being used to underpin operations in the current financial year. So when you start off looking at earmarked reserves, you say to yourself, so we've got the money for a project. When that is all complete, there is no financial projector. Everything breaks even. That may not be the case, especially when you've had significant pay awards as we've had in the last year. So if you got money for something that was due to cost 100, once all the pay awards have come in the next year and the year after that, it might now cost 103 or 104. So I'm concerned that there are pressures in these earmarked reserves, and we need to, what we're doing at the moment, all the management team and myself, we're working through let's just try and quantify all these things up. The second thing that we have are what's called general reserve. Actually, I don't think they are technically called general reserves, but I call them general reserves. Now, general reserves are exactly what they say they are. They are money that is generally available to the IJB. That money has come from underspends within health or within social care, or sometimes within both. The money goes into the IJB's general reserve, and the IJB has a general reserve in the same way that councils have a general reserve, because there is no more money out there, and therefore if the IJB runs out of resources, it has to dip into its reserves. The IJB has a reserve strategy. It says it'll keep its reserves around 2% of its turnover, which is almost exactly £4 million, which is what the current reserve is projected to be sitting at. So I just thought it's it's important to clarify some of these things. Now, as I say, the rest of the paper I like to think is relatively straightforward. So, Chair, if I could take any questions on that.
Okay, thank you, David. Do we have any questions for David? Questions or any comments? I don't see any hands up at all. And David, what you've said is that you've got the earmarked reserves. What you're not able to say is the level of pressure on the earmarked reserves, and the other ones, which the unallocated ones, would be the ones that we're going to use to balance out any
in extremis, yes,
understand.
absolutely. I mean, what we should use the general reserves for is, as you say, to soften out any humps and bumps in between years. So 1 year there's financial pressures, and you use some of the general reserve, and the next year there should be surpluses. Now we're just about to come on to talking about what next year and the years thereafter look like. So it seems highly unlikely there's going to be any more surpluses. But yes, that's exactly right, Chair. And the other thing one can do with general reserves, of course, is use it to support longer term plans. So if we're putting together a recovery plan that might take 2 or 3 years to develop, we can use some of the general reserves to get ourselves through those particular years. So that the general reserve is an opportunity. To come back to your point about earmarked reserves, and I think in the past, certainly in the past, in my experience, earmarked reserves have, as I said, washed their own faces. You get 100, you spend 100, that's absolutely fine. I think now, given the inflationary pressures in the system and the fact that there are still money being used from previous investments to underpin, I'm not 100% clear on how much these figures are, but to underpin current expenditure, that needs to be flushed out, and we can build that into our financial planning process. In actual fact, I have built it into our financial planning process, and we'll come on to talk about that in a minute.
Okay, thank you. Could I ask one more question around demographic change? I think all partners fare really badly in the funding formula that's been allocated. And I've been asking finance colleagues in each of the partner organisations, are you hearing any discussion or debate amongst yourselves in the civil service around any changes to that funding formula, acknowledging our demographic growth, because the census figures have now come out, so that gives us a much better picture of where we are as East Lothian, and I just wondered if that has is that something that you're seeing coming through at all, or discussions taking place on that?
Well, if I can be fair to the Scottish Government, the model does actually take account of population change. So in theory, if population grows, then the allocation to the council gets more, and the health system, the so-called NRAC, that should give those boards more money as well. However, the problem is, of course, that there's losers and gainers. Now, just because your population has decreased doesn't mean the costs of running your services decreased by very much, because the unit cost of these things isn't actually a particularly meaningful measure. And there's all sorts of mechanisms in place to protect the losers. And that, of course, impacts upon the amount of money that can be given out to I was going to say winners, that's not right, to those who would benefit from the redistribution. There probably needs to be a better model, Chair, but it's very, very difficult to think what it is. So I haven't heard any plans to change the model or anything that would benefit us, where we are clearly losing out this process because our populations are increasing greater than other parts of the system.
Okay, thank you. I'll pick up that issue around growth and money allocated to growth, because I'm not aware of seeing that in the system, but I'm happy to pick that up with you offline. Andrew?
It's just to go back slightly, David, to what you were saying before about projecting the year-end position. Is what you're saying is that it's likely to be understated, that our position could be worse at year-end once you've flushed out those issues? And if so, when would you be clearer in understanding that to come back to the IJB?
Okay, I don't think the position is going to get worse. What I was trying to say, and clearly I wasn't saying it terribly well, what I was trying to say is if there are pieces of current expenditure in our system at the moment that's being underpinned by money from earmarked reserves, i.e. non-recurrent monies, then next year that will come to fruition. So that support that we've got in 3-4, we will not get that support in 4-5, is what I'm trying to say. So I apologise, Andrew, I wasn't very clear, but I'm just trying to think ahead of the financial planning process.
Yeah, so you're basically saying it's an issue for next year. We need to be aware of it now, though.
Yes, yes, and that's part. I'm hoping to bring a much. I'm hoping to flush a lot of this stuff out. As you can see from, well, we haven't got to my next paper yet, but you can see from my sort of discussion notes, I'm hoping to flush some of this out so we can sit down and much more clearly understand A, how we got there, B, what the issues are, and then we can move on to say, well, how can we sort some of these things out in the most sensible way?
Okay, thank you. Do we have any other questions or comments for David? Okay, thank you. This paper requires a roll call and it's 2 recommendations for noting, and I think we'll have an opportunity to look at this in a lot more detail, Andrew, with our workshop scheduled in January. Okay.
Thank you, Chair. The recommendations are set out in section 2. Just looking at the right report, which are for noting. So if members are happy to note this paper.
Elizabeth, that's agreed. Elizabeth?
Just before we go to the recommendation, could I just check, is that the workshop that might have a change of date from the 25th of January to the 30th of January?
Yes, that's right. We're looking at an alternative date.
That's fine. It was just because it was in the recommendation with the date. I just wanted to clarify that. Thanks.
So that will be on the 30th of January. Thank you for flagging that up, Elizabeth.
So are members happy to note the recommendations?
Yes. Agreed.
Yes.
Agreed.
Thank you. Oh, you're on mute, Chair.
Sorry about that. And move on to agenda item number 10, which is IJB audited annual accounts for 22-23. And is that with yourself, David?
Sorry, forgive me. Yes, we've skipped past the financial planning paper.
Sorry, no, paper 9.
So we've talked about the Q2 position, and 9 is the financial planning paper, or an outline of the financial planning paper, I should say. And in actual fact, that's where I mentioned the 25th of January. So you're absolutely right, Elizabeth, that date has been moved, and clearly we can pick that up in the minutes. So the question then, of course, is what happens next? And what happens next, of course, is the Scottish Government will announce, we spoke about that earlier on, will announce their budget next year, next week. And that information obviously will go across the whole system into our partners. East Lothian Council, I think, have to set a budget before the end of February. NHS Lothian, I think I mentioned this, is slightly different because they have to break even at the end of the year. So what they do at the beginning of the year is they sort of lay out all the various pressures in the system and then work towards getting broken even at the end of the year. And the challenge, of course, for the IJB is to take these 2 disparate things, and what the IJB has to do in exactly the same way as the council is to set a balanced budget at before the start of the year. So we will get offers from our partners, an offer from East Lothian Council and an indicative offer from NHS Lothian. And that, of course, will inform the planning process in a great deal more detail. Now, I mentioned this whole business of sort of brought forward underlying pressures. And I do this for a reason. NHS Lothian recognised many years ago that there were a whole lot of pressures in their system which they were managing on a non-recurrent basis. So if Craig were here, he would tell you the same thing. There's about £104 million worth of systemic pressures, and they have to be managed through the system, and the system manages them every year and tries to reduce that 104, and the whole object of the exercise is to move back into a recurrent balance over a period of years. Now, the council quite rightly set a balanced budget, and therefore the end of the year one should be broken even, and therefore next year's pressures are pay awards above inflation or inflationary settlements in various contracts, or demography, which we've just been talking about here. But what concerns me greatly is that there may be underlying pressures in the current year's position, which is what we've been talking about. And what I've done is I've taken that forecast, the current forecast, that £2.8 million, and I've said, well, we start off next year, we've got a £2.8 million gap. Now, as I explained a wee while ago, we will be going through that, and we will be fine-tuning all these figures, and we'll be looking at what the real number is. So you start off, if you like, at the top of the page with a £2.8 million gap. There's all the other pressures that come underneath it. That then gives a figure at the bottom of the page, and that casts back up the page again. So the numbers simply get greater and greater and greater. Now that list looks awful, but the reason why the numbers get greater and greater is because there's no impact of any management actions in there. So if you think about what I've just said, if we resolve that £2.8 million of recurrent pressure, then that very first year drops by £2.8 million, and the second year drops by £2.8 million. It's the way the arithmetic works. But it's important to flush all these things out. Somebody said to me the other day, you must plan for the worst and prepare for the best. Well, I may have said it the other way around. And the important thing here is what we need to do is work out exactly, or not exactly, but work out what the worst case scenario may be. Now, of course, this is not necessarily the worst case scenario because we don't know what the government settlement's going to be for 24-25, but we must start somewhere. And I wanted to flush all these things, and I wanted colleagues to sort of understand what I was trying to do and understand the way I was trying to do it, so we can have a conversation about it rather than me giving you tables and numbers and saying this is terrible, move swiftly on. It is extremely challenging, but this is how I've arrived at this challenging position. I would be keen actually, and I hope we can do that, not on the 25th of January, but the 30th of January, to have a much more broader conversation about what do these numbers mean, how do you get to these numbers, and therefore what kind of things can we start to do in order to resolve some of these pressures. Excuse me, I'm sorry. So what do we need to do? What we need to do now is, first of all, refine the forecast, sort out some of these issues I've talked about. What we will then do, and our partners are very, very good, they're very interactive with us, so we will hear by January what kind of ideas the partners have in their head, what kind of indicative position they might have for 24-25, and therefore we can have a much more realistic conversation. And let us be very, very honest about it here. It is very, very unlikely there'll be much money forthcoming either from the Scottish Government or indeed from the partners, who of course are completely funded by the Scottish Government. So there's going to be an enormously challenging position. We refine the numbers, we get a number and we understand where it came from, we understand how it was arrived at, and therefore we understand what we're going to do with it. The next thing to do then is to look at a series of, let's call them recovery plans, a series of financial proposals that will reduce the gap and allow us to declare a balanced budget. Now, in order to do that, we have to assure ourselves that it meets the IJB strategic plan, the IJB strategic goal. So there's a considerable amount of work to do here, and I am aware in actual fact that we're running very, very short of time. So I think you've read the rest of the paper, and I don't want to sort of go on too much. I hope you can see how we're trying to get there, and therefore once we've got there, I think it'd be much easier to understand what we then have to do about it. Shall I again stop talking, Chair, and take some questions?
Okay, thank you. Do we have any questions or comments for David? I don't see any hands up. David, I'll probably just leave this for you to take away. Around in the previous paper, you'd mentioned a piece of work being carried out on the set aside health services about correct charges against those budgets. I wonder if that piece of work, is that something that will be available for our workshop session, or is that a bit of a long-term piece of work?
It's a long-term piece of work. It's not going to be available for January, but I think all the IJBs are now very, very conscious of the fact that we've kind of parked set aside for far too long now, and we need to come back and fully understand it and share it with all our colleagues in the room and just see what we can realistically do about it. But it won't probably be ready for January. I'm sorry, Chair.
Okay. I've got Andrew and then David.
Yeah, it's similar to Shameen's question, but about the core budgets. Will you have enough information by the workshop of the offer from both NHS Lothian and the council to make the workshop at the end of January meaningful?
We'll have to, it must be meaningful, because we must set a budget before the 31st of March and the clock is ticking. We may not have absolute definitive numbers. If the council haven't set a budget, it's not up for us to tell everybody what the council's budget is going to be. However, what we can do is we can say, like, it's within those parameters. So we can say, you know, either it's, I'm not going to make up numbers, but we can say it's within those parameters, and that will allow us to work meaningfully. And I really, really hope that January workshop, we can come out of that with some clear view of the challenges ahead and how we're going to address them.
That's reassuring, David. Yeah, that's reassuring.
Thanks, Andrew. And David?
Hi. I'd find it quite helpful for the 30th of January to have a better understanding of what the statutory and legal responsibilities are in relation to the deployment of finance and statute and legal. I'll leave that with you, but I think there's an inclination to think of things that can't be touched, but actually they can, and then there's an inclination to think, well, this is not a statutory or legal responsibility, therefore we can examine the scope for changes in its budget more rigorously. But I'd like to have a better understanding of the equation on the other side.
I think that's a tremendously useful point, and there's a huge debate about statutory, especially in the health service. You know, what are the statutory requirements of the health service, and that's extraordinarily ambiguous. What I think we should do, but sorry, there's two things. First of all, we should do with the integration scheme and what the 2014 Act says is how are we going to deliver the 9 goals, I think, and we have our own goals and ways of delivering them. And secondly, we need to be realistic. There are a whole lot of things that have happened that are going to continue to happen. You know, we are not going to close down any delegated wards in the Royal Infirmary of Edinburgh or the Western General. So there are things that are not going to be changeable in the short period of time. We have to reflect. You make a really good point. I've shown a percentage at the bottom of the page. What would be a sensible percentage based on those things you can actually change? And that's the kind of we'll try and tackle, David, because I think it's really, really important that everybody just understands how we got here and therefore what options we have to make our changes.
Okay, thank you. I don't see any other hands up or any comments or questions for anyone. Okay, thank you. We'll move on to the recommendations.
Thank you. The recommendations are set out in 2.1 with the just slight amendment to recommendation 3 that the workshop will likely be the 30th of January rather than the 25th. So if I could, I'll go through the roll call if members could confirm their vote, please. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Fiona Ireland.
Agreed.
Councillor McFarlane.
Agreed.
And Peter Murray.
Agreed.
Thank you.
Okay. We'll move on to the last agenda item, number 10, IJB audited annual accounts for 22-23. Is that yourself, David?
I'm afraid so. As members are aware, it's taken us a wee bit longer than we intended to prepare and finalise the 22-23 annual accounts. These accounts have now been audited by the external auditors. Rachel Brown is here, and she represents our external auditors. They've been audited by the external auditors. The external auditors have given a paper, have written their view on the annual accounts, and that is attached to the bottom of this report. The IJB's Audit and Risk Committee met last week, and the external auditor and Rachel came along, and the Audit and Risk Committee spent quite a lot of time obviously talking their way through this, looking at what the auditors were saying, quizzing us, Fiona and I, sort of the members of the management team, and sort of reassuring themselves that they understood what the audits were. We have accepted all the recommendations. There's a whole series of recommendations at the very end of the auditor's report. So the Audit and Risk Committee are recommending to the IJB that they accept the annual accounts, and therefore they approve the annual accounts. The annual accounts will then be signed by myself, by the chair, and by Fiona, and then they will be published in various places and become part of the record. So I guess the question then, well, the recommendation is obviously to note the conference, well, in fact, to look at the annual accounts. I don't know if you've had a chance to look at them before. To look at the annual accounts, to note the comments of the external auditors, and to approve the annual accounts.
Okay, thank you, David. Do we have any questions or comments for David? Or if anybody from Audit and Risk wanted to say anything? Fiona Ireland?
So as Chair of Audit and Risk, I would just say that, you know, as David said, that the accounts were taken last week to Audit and Risk Committee. We had previously had quite extensive discussion about them when they were in draft format, so they probably got an easier ride last week than than they had on their first outing. But yeah, we would recommend them to the IJB.
Thank you. Do we have any other questions or comments for David? No, I don't see any hands up. Just want to say thank you to everybody who have worked hard to pull this together. I know the auditors had difficulties and staffing issues in getting it done, so I want to thank everybody for getting it over the line and getting it to the stage, and also all the members of the Audit and Risk Committee for your scrutiny, and we'll accept your recommendations. I think I'm just conscious of time, but I'm also aware of the significant amount of work that's outlined that happens behind these, and you've got pages and pages of that, and around, I think just looking at page 90, point 10, East Lothian IJB is performing above the Scottish average in most of the national integration indicators. So that's a testament to the amount of work that's gone on behind the scenes to support people across the county, and we'll accept the recommendations. I would take a opportunity to read the kind of the initial pages, because it gives you a good overview of the plethora of work that's going on, and to thank the staff for all the work's going on behind the scenes. Okay, are we happy to?
We'll need a roll call, Chair.
Yes.
So the recommendations as set out, if members could indicate their vote. Councillor Akhtar.
Agreed.
Andrew Cogan.
Agreed.
Jeremy Finlay.
Agreed.
Elizabeth Gordon.
Agreed.
Fiona Ireland.
Agreed.
Carol McFarlane.
Agreed.
And Peter Murray.
Agreed.
Thank you. That's the recommendations approved unanimously.
That's great. Thank you very much. Just before we finish, Ms. Curry, I just wanted to say this is Peter Murray's last East Lothian IJB meeting today, and I didn't want to finish our meeting without saying a few words. I tried to find out as much about him as possible, but that was very difficult because he lives a very private life. But what I do know is for the last 30 years before he joined the health and integration world, he spent 30 years of his life in the public sector in the Scottish Fire and Rescue Service. And when I met him, and I knew I'd googled him, I knew that was his background, and I thought I'm going to learn a lot from him. And I just want to say, Peter, so I want to thank you for all the support that you've given and all the things that I've learned from you. And I also know that you've been an Aberdeen Football Club fan probably more than 30 years. And I know that you're moving back might have already moved back up to Aberdeen, but that was your home and you'd moved away, so you're back up in Aberdeen. So we wish you all the very best up in Aberdeen, and hope that you will still keep in touch in the health and integration joint world. We might see you from Aberdeen, but just to say on behalf of East Lothian IJB, to thank you for all your help and support, because you've been a member for a number of years, and we've really appreciated all the help and support and insightful comments. So thank you very much, and wish you all the best.
Thank you. Can I quickly respond?
Yes.
Well, first of all, thank you for that. I hope David King is miserable on Sunday afternoon at 4:45. For those that don't know, David is a Rangers fan, so that will make my day. In fact, it'll probably make my year. But on a more serious note, it's been an absolute pleasure. I've been here for, I think, 7 years. Chair twice, vice chair twice. So it's around about 7 years. I don't know exactly. Fiona will tell me, I'm sure, but it's around about 7 years. So I've met a lot of people. I've met a lot of very good people. There are a lot of very good people on this board and supporting the board. I wish you all the very best in the future. I want to pay particular thanks to a couple of people if I can. Also Shemaine for her support and her role as vice chair when I was in the chair position. I did say Fiona O'Donnell. Most people here will know Fiona, and Fiona was very helpful to me in both her time as chair and as vice chair, so thank you to her in her absence. I'd like to thank Laura for her cheek. She's certainly been quite cheeky to me over the years I've been on the IJB, so thank you, Laura, for all your cheek. And thanks to Paul. Paul's been a stalwart and really helpful to me in the time I've been, I think, with him for the whole time, Paul, if memory serves me right. Yeah, I think that's probably right. David Small, Alison MacDonald, who you'll all know, who have been the previous chief officers, And of course, to finish off, the current Chief Officer Fiona, I wish Fiona all the best in what will be a very difficult task. And I did say thanks to Fiona Ireland last week at the full board meeting. I will repeat that thanks here, because it was in this capacity in particular that I thanked her, because she's done a lot of work in this particular role. She gets on with it without any fuss, but does a pretty solid job. So thank you, Fiona.
Okay, thank you very much, Peter. All the best, and keep in touch. I won't see everybody till January, so I wish everybody a very happy Christmas and a happy New Year as well. So thank you everybody for their participation today. It's much appreciated. Thank you.
All the best, Peter.
Thank you.
Thanks.
Shameen and Fiona, can you stay on the line, and we'll stay in the